Hello, what are the risk factors for developing Parkinson's disease? Now, age is a risk factor. The older you are, the higher the chances of getting Parkinson's disease. Parkinson's disease is caused by lack of dopamine in the brain. It is also due to accumulation of an abnormal protein called alpha-synuclein. And the older you are, the higher the chances of accumulation of this protein. Some cases of Parkinson's disease are due to genetics or their hereditary cause. We tend to suspect hereditary cause as a reason when the person with Parkinson's disease is young. If you get Parkinson's disease in your 30s or 40s, there is a possibility that genetics played a role. The other risk factor for Parkinson's disease is exposure to certain herbicides and dry cleaning solvents. So it has been found that these herbicides or common weed killers can stay in the soil for many years, and they may also evaporate into the air and hence cause exposure in susceptible people. It has been found that people who have worked with these chemicals and dry cleaning solvents, there has been an increased chance of developing Parkinson's disease. It has also been found in people staying in buildings where these pesticides and herbicides have been sprayed around the building. They have also had an increased chance of developing Parkinson's disease. The fourth risk factor for Parkinson's disease is trauma to the brain or traumatic brain injury, which can be sustained from playing games such as soccer, football, or in boxing. And this is not caused by a single head injury. It is caused by repeated trauma to the head. And this can trigger inflammation and accumulation of the abnormal protein called alpha-synuclein. Now, what is the treatment of Parkinson's disease? Parkinson's disease is one of the most satisfying diseases that I have treated. There are a lot of medication available for Parkinson's disease, and somebody with Parkinson's disease can have a good quality of life and can live a long, productive life. Now, the traditional treatment of Parkinson's disease is a drug called levodopa. Till today, it remains a gold standard of treatment. It was initially discovered in the 1960s, and this drug or substance is still unmatched till today. Levodopa is converted to dopamine in the brain, and this dopamine, or rather lack of dopamine, is what causes Parkinson's disease. So when levodopa is converted to dopamine, it helps to alleviate the symptoms of Parkinson's disease, that is the stiffness and the slowness. There are also other drugs that can be given to help with the shakes or the tremors. In addition, Parkinson's disease patients have a lot of symptoms that interfere with their sleep, and this can also be very effectively treated. Parkinson's disease patients may have insomnia because they are stiff and they can't sleep. They may have sleep apnea, where the tongue falls back and obstructs the airway when they sleep. They may also have restless legs, which is a condition where there is a tendency to move the legs more towards the evening and night, and this disturbs their sleep. And there is also effective medication for restless legs. Now, levodopa is one of the drugs used to treat Parkinson's disease. There are also other variations of dopamine which can be given to patients with Parkinson's disease. Besides this levodopa, available in tablet form or pill form, recent advances has made levodopa available in liquid form, and this can be administered via a subcutaneous pump. This subcutaneous pump can be carried around and it can be given subcutaneously for 24 hours. So round the clock exposure to levodopa, it helps with the stiffness, shaking, and the slowness. Besides that, there are also surgical options for Parkinson's disease. One very established treatment for Parkinson's disease is deep brain stimulation surgery. And this has been around for 20 years. Now, in deep brain stimulation surgery, electrodes are placed in the brain, targeting the area involved in Parkinson's disease. And these electrodes are connected via an external catheter or wire to a stimulator which is placed below the collarbone. So this stimulator, when it is turned on, stimulates the area of the brain involved in causing these Parkinson's disease symptoms, and it then alleviates the shakiness and the slowness and the stiffness. This is a very well-established treatment, and it has helped many patients lead a normal, productive life, and after surgery, the dose of levodopa can be reduced. There is also another recent advance in surgical treatment in Parkinson's disease. That is, it is now possible to do ultrasound to the area of a brain that is specific for Parkinson's disease, and this focused ultrasound, when targeting the area involved in Parkinson's disease, can alleviate the symptoms of Parkinson's disease. So this is a very exciting time in the field of Parkinson's disease. I hope you've enjoyed this video and benefited from watching this video. Thanks for watching, and I'll see you next time.